Hi, this is Laura from Feeling Fabulous. I'm a board-certified physician assistant who has been working in the field since 1997. I've worked in internal medicine, alternative medicine, family practice, internal medicine, ER, and now hospitalist. And I recently just found out about lifestyle medicine about 2 years ago. It's relatively new, however, they've come out with the boards in the last 2 years, and so I became board certified in it. So I found out about lifestyle medicine actually through a different route. One of my friends, who was my roommate in college, we were doing a plant-based business. And she actually found out about lifestyle medicine. So I started to look into it because she was praising it and saying that it seemed to be the better answer to what we were looking for, because we really cared about getting patients well and not prescribing so many medications. So basically treating the root causes. We're looking into a different form of medicine. And once I started to look into it, is the American College of Lifestyle Medicine. They had a lot of CMEs and became a member, obviously, of the college. Looking at the webinars and the information about where it was coming from and all the sources and the studies that they were basing it on, I quickly decided that that was the route that I was looking for, because I was really looking for getting people healthier through coaching, helping them live a fuller, happier life. Because it did. It took me a while to figure out what my purpose was. After a while, we kind of get burned out in our field. We keep seeing the same things, and I kept feeling like I wasn't really helping people anymore. I would try to give them information and education in the hospital, but that's only a small portion of their entire picture. Because once they leave the hospital, then they're out trying to figure their way. With all the misinformation out there, it's really easy for people to get disenfranchised, basically, and then they don't do anything because they have competing information and they get overloaded easily, and the next thing they know, they're not doing anything. Because one person says it's okay to eat what they're doing, they want a reason why they can do what they do. So unfortunately, that's bad part about the internet, is because it has a lot of information and they don't really know what source it's coming from. They think they can trust it, and that becomes an issue. And if we're not educated enough to inform our patients, they're going to seek it elsewhere. That's the bottom line. And unfortunately, when they go to their doctor and they get a 15-minute visit, they don't even have time to think. They have to have it pre-written, and usually we don't have time to talk about more than 2 or 3 problems at a time, and then they have to keep coming back. That form of our profession is debunked. It doesn't work very well, because preventative medicine is, it's supposed to help them prevent diseases. It's not just meant to give them preventative tests just to make sure that they don't have colon cancer. Well, why don't we teach people what to eat so that it helps them prevent colon cancer? It may not always in every single case, but if we know that fiber is a great source of preventing colon cancer, and eating meat is a way to actually promote colon cancer, then why don't we tell patients not to eat as much meat? That's why I got into it. I really feel strongly about helping patients feel better, live better, and have less issues that we can help them with. It's about treating the root cause of the problem, which means that the nutrition, stress management, sleep hygiene, weight management, all those holistic, total person ideas are in lifestyle medicine, versus the other westernized version of medicine, which is the patient is a passive participant. They don't have the accountability about lifestyle, mainly, unfortunately, because we don't have a whole lot of time to talk about it. We're mainly focused on the problem that they're coming in and what drug to give them. It's not really helpful because patients are still looking for other ways of treating themselves, because we're not treating the root cause and they're looking for alternatives. That's why the supplementation business is so big, and patients are coming in with pages of supplementations versus medications sometimes. So in finding about lifestyle medicine, I became super passionate about getting people off their medications. So I do have a consultation business outside of the hospital, because my focus is getting them off the medication. I don't mind treating acute problems, and I don't mind treating chronic issues that are capable of changing with lifestyle in addition to medication, and then you can wean off the medication, because that's the point. You want to get as low as possible or no medication, because those medications have side effects, and even if you don't realize it, it does. That's why I chose it, because our medical system is broken. We keep seeing the same patients over and over again in the hospitals, and we can't function like that.